with the pec, male or female. Um, the goal is, of course, get that tucked in. We have two heads. We have the clavicular head. You see that one that comes up here, right around here is the clavicular head. And then we have the sternal head, which comes in a lot deeper. If you, especially female, as long as you stay at the top portion, you're fine. You're gonna get plenty of that tissue, that upper pec tissue, all right? But I'll show you how to angle this hand so that you can get a little bit more without exposing the breast tissue. So for guys like myself and Christian, the tuck has to be a little bit more. Same thing for you ladies. But at the base of the table, as long as you get the draping above that nipple region, you're fine. And you'll see like a little, bubble. You'll know that the breast tissue is exposed. So to warm this up, I'm going light on the clavicle region. Let me take off.
Very nice. Very nice.
So I'm here. Let me show you guys the other what I was talking about. So this is the windshield.
Yeah, she did that, yeah.
Yeah, so this is the windshield.
But I couldn't see it.
You showed that
Yeah.
it was more like a strip.
Hers,
Right.
well, she was just doing this one, right? The reason why I go here, because it gets, you feel that on? There's a special thing right here that you get when you do that twist. All right, so warming up. All right, so you do have the option, and I'm gonna show you all the options and why some I like and some I don't like. This is why I don't like coming across, because you see my hand is like in her face region. All right. And it doesn't allow me to do what I need to do there. What I like to do with the pec is, and we know we got the clavicular attachment here, is I kind of just use my palm here, press down and come out, but we know we got it right there as far as the attachment on you take a look at the crest of the greater tubercle, all right? So I have access of controlling the attachment site, the insertion for this pec for me to get, and you see it right here. So this is more than enough to address that pec tissue. So I can come out here. This feels a lot more comfortable when treating that. I can come out here and do it. And then if I need to get a release of the pec, I can get right in here. If you come around here and you'll see. Oh yeah, thank you.
Gotcha.
You speak in the mask and then goes up towards your forehead. So you'll see here, this line right here allows me to get in. It's a little bit uncomfortable. But pick up this tissue if I need to get a pec release. So this is mainly for the guys or the girls that lift weights and so forth. But I'm just getting in and getting a release on that pec tissue. All right. All right. Now, if you want to stay on the same side, instead of going over the face, now you have the option to getting here and stripping these fibers. But just keep in mind, you're going in the opposite direction of where the muscle fibers go out. So this might be.
Do you go like kind of like a pec anterior deltoid?
Yeah, that's why I like doing that sweep with my hand. But if you need to stay on the pec Yeah, you can do cross fiber and go in this direction.
Because the fibers go this way.
Yeah, so now you see I'm changing it.
In the straight direction.
And this one is a little bit better because you're not crossing over the face. They see I'm on this side. This is her sternum. Are you okay?
Mm-hmm.
And this is all pec. But as I come up here, we talked about the coracoid process. We have the pec minor, the coracobrachialis. We got three muscles that attach up here. This is tender. So my stroke from here gets a little bit lighter as I get up here. And the reason why I like those two strokes, because I can press downward and get more of the pec without exposing the nipple. You see what I'm saying? Because remember, the breast tissue is just adipose tissue. So it's gonna either move off to the side or stay tucked underneath the sheet. So here I'm just spacing out. You okay?
Mm-hmm.
That's subclavius, what I was telling you about. There is a release right in here. This is high-tech stuff, so. But I can get a release underneath her clavicle. Like right under with some friction. All right, any questions with the pec? Let me show you this again. Arm out here. Sorry. Arm out here.
That's how you start, right?
Yeah. Start here. And then you could come with the fibers, or you could just know when you're going against the fibers is a little bit more, it's more intense because you're going the opposite direction of the contraction of those muscle fibers.
How would you do like a pec, anterior deltoid, bicep?
So a pec, we're gonna get to, I think the bicep is the next one, right? You could press it. Is the coracobrachialis?
Pec minor.
Yeah, so go back to pec minor. So same thing with pec minor. We're hitting that with this treatment as well. So
Okay.
pec minor, because the coracoid process is right here. If there is complaint of restriction or tingling, any issue with those brachial plexus, the nerve, all you have to do is kind of friction, get some friction on that pec minor, and you'll break that up. You'll release that. So if Alma was complaining of pain running down her finger here to the hand, then you would have to get in and work this pec minor. So this is pec minor and pec major, a little bit of pec major. But this is getting in to release any of that
What do you
restriction. It's just all I'm doing.
pinching it?
Yeah, you can stick your finger in. Yeah, that's it. You feel it?
And then it's just
Yeah, it's just the money. Yeah. So that's all it is you getting in there. Because it's a thick band of muscle. You feel it. So all I'm doing is I'm making sure I'm going towards her eye. See? And but that's if there's a complaint. Because this is more advanced work. This is like neuromuscular treatment. When you're doing that, it's neuromuscular. All right, but if you're just doing a general pec release, you're here. All right, so that's pec minor, and then what was the other one you said? Anterior delt?
In the sequence that it was the anterior delta and the bicep.
Okay, so-
I think it's the coracobrachialis next.
Subclavius, I just showed you guys that. All right, so pec major here.